Which part of the respiratory system is responsible for gas exchange? Option A bronchi, option B alveoli, option C trachea, option D larynx. The correct answer is option B alveoli. Alveoli are tiny air sacs in the lungs where oxygen diffuses into blood and carbon dioxide diffuses out. The next question. Which enzyme converts carbon dioxide into bicarbonate in red blood cells? Option A lipase, option B amylase, option C carbonic anhydrase, option D pepsin. The correct answer is option C carbonic anhydrase. Carbonic anhydrase catalyzes the reversible reaction between carbon dioxide and water to form carbonic acid, which helps maintain blood pH. What is the normal respiratory rate in a healthy adult at rest? Option A 10 to 12 breaths per minute. Option B 12 to 20 breaths per minute. Option C 20 to 30 breaths per minute. Option D 20 to 35 breaths per minute. The correct answer is option B 12 to 20 breaths per minute. The normal respiratory rate in adults is between 12 and 20 breaths per minute, ensuring adequate gas exchange. Which structure prevent food from entering the trachea? Option A vocal cords. Option B uvula. Option C epiglottis. Option D soft palate. The correct answer is option C epiglottis. The epiglottis is a flap of cartilage that covers the trachea during swallowing to prevent aspiration of food or liquids. The next question. In which part of the brain is the respiratory center located? Option A cerebrum, option B cerebellum, option C medulla oblongata, option D thalamus. The correct answer is option C medulla oblongata. The medulla oblongata on pons regulate the rate and depth of breathing by responding to changes in blood gas levels. Next question. What happens to the diaphragm during inspiration? Option A relaxes and move upward. Option B contract and moves downward. Option C relaxes and move downward. Option D contracts and move upward. The correct answer is option B contract and move downward. During inhalation, the diaphragm contracts and flattens, increasing thoracic volume and drawing air into the lungs. The total lung capacity is the sum of option A tidal volume plus residual volume, option B vital capacity plus residual volume, option C inspiratory reserve and expiratory reserve, option D tidal volume plus vital capacity. The correct answer is option B vital capacity residual volume. Total lung capacity represents the maximum amount of air in the lungs can hold, including air that remains after forced exhalation. Which condition is characterized by destruction of alveolar walls? Option A asthma, option B emphysema, option C tuberculosis, option D pneumonia. The correct answer is option B emphysema. Emphysema involves damage to the alveoli leading to reduced surface area for gas exchange and shortness of breath. Next question. Which gas primarily stimulate the respiratory center? Option A oxygen, option B carbon dioxide, option C nitrogen, option D hydrogen. The correct answer is option B carbon dioxide. Increased carbon dioxide levels in the blood stimulate chemoreceptors, which signals the medulla oblongata to increase breathing rate. Which of the following condition is caused by Mycobacterium tuberculosis? Option A asthma, option B COPD, option C tuberculosis, option D pneumothorax. The correct answer is option C tuberculosis. Tuberculosis is a chronic bacterial infection caused by Mycobacterium tuberculosis, affecting mainly the lungs. The term apnea refers to option A rapid breathing, option B difficulty in breathing, option C temporary cessation of breathing, option D painful breathing. The correct answer is option C temporary cessation of breathing. Apnea is a temporary pause in breathing commonly seen in sleep apnea syndromes. The next question. What is the normal tidal volume in healthy adult? Option A 200 ml, option B 300 ml, option C 500 ml, option D 700 ml. The correct answer is option C 500 ml. Tidal volume represents the amount of air inhaled or exhaled in a normal breath, approximately 500 ml in adults. What happened to alveolar pressure during inspiration? Option A increases, option B decreases, option C remains constant, option D become equal to atmospheric pressure. The correct answer is option B decreases. During inspiration, thoracic expansion reduces alveolar pressure, allowing air to move into the lungs. Next question. Which structure carries air into each lung? Option A trachea, option B bronchi, option C bronchioles, option D alveoli. The correct answer is option B. Bronchi. The trachea divides into right and left bronchi. Each enters its respective lung to distribute air. What is the main component of respiratory membrane? Option A, alveolar wall and capillary wall. Option B, tracheal cartilage. Option C, bronchial lining. Option D, pleural membrane. The correct answer is option A, alveolar wall and capillary wall. The respiratory membrane consists of alveolar and capillary walls where gas exchange occurs. Next question. Which of the following is a restrictive lung disease? Option A, emphysema. Option B, asthma. Option C, pulmonary fibrosis. Option D, bronchitis. The correct answer is option C, pulmonary fibrosis. Pulmonary fibrosis causes shifting of lung tissue, reducing lung expansion and compliance. Next question. The oxygen carrying capacity of blood depends mainly on option A, plasma proteins, option B, RBC, option C, hemoglobin concentration, option D, WBC. The correct answer is option C, hemoglobin concentration. Hemoglobin binds oxygen in red blood cells, determining how much oxygen can be transported. Next question. What is the function of cilia in the respiratory tract? Option A, gas exchange. Option B, trap dust and move mucus. Option C, produce mucus. Option D, filter carbon dioxide. The correct answer is option B, trap dust and move mucus. Cilia sweep mucus and trapped particles upward to keep airways clean. The voice is produced by vibration of option A, glottis. Option B, vocal cords. Option C, laryngeal cartilage. Option D, soft palate. The correct answer is option B, vocal cords. The vocal cords in the larynx vibrate as air passes through, producing sound. Next question. The partial pressure of oxygen in alveoli is approximately option A, 40 mmHg, option B, 60 mmHg, option C, 100 mmHg, option D, 120 mmHg. The correct answer is option C, 100 mmHg. The alveolar oxygen partial pressure is about 100 mm of Hg, ensuring efficient diffusion into pulmonary capillaries. Next question. The exchange of gases between tissues and blood is known as option A, external respiration, option B, internal respiration, option C, cellular respiration, option D, pulmonary ventilation. The correct answer is option B, internal respiration. Internal respiration refers to exchange of oxygen and carbon dioxide between body tissues and the blood. Next question. The nasal septum divides the nasal cavity into option A, upper and lower house, option B, left and right house, option C, front and back house, option D, superior and inferior house. The correct answer is option B, left and right house. The nasal septum is a partition made up of bone and cartilage that separates the nasal cavity into two halves. Which of the following occurs during expiration? Option A, diaphragm contract, option B, thoracic cavity expands, option C, lung recoil, option D, air pressure in lungs decreases. The correct answer is option C, lung recoil. During exhalation, the diaphragm relaxes, lung recoil, and air is pushed out as lung pressure rises. Which of the following disease is caused by long-term exposure to coal dust? Option A, asbestosis, option B, silicosis, option C, pneumoconiosis, option D, bichinosis. The correct answer is option C, pneumoconiosis. Pneumoconiosis is a chronic occupational lung disease caused by inhalation of coal dust particles. Which nerve supplies the diaphragm? Option A, vagus nerve. Option C, pharynx nerve. Option C, glossopharyngeal nerve. Option D, accessory nerve. The correct answer is option B, pharynx nerve. The pharynx nerve originates from cervical nerves 3 3 and 3 5 and controls diaphragm movement for breathing. Thank you.